Okay, we're going to go ahead and get started this morning. We're at 9 o'clock. We do have a large number of attendees that have logged in already today, so we'll kick off now that I think we're ready to go. My name is Caroline Sanner. I am joined here with the rest of the iPro ESRD Network team for a best practice call today. So what this is, in the community, every day we work with facilities to improve the quality of care that our dialysis patients receive. And through this work, we identify high-performing facilities and invite them to come share what they're doing on these calls with everyone else. Today, we are joined by Seneca Ridge Dialysis. I came across this facility a couple of months ago, and I said, stay tuned. I'm probably going to reach out to you later for a best practice call. They actually reached out to us at the network to see what they could do to improve. And then as we started talking, I realized they were already doing most things that would set you apart from other centers, primarily in the waitlist and transplant space. So as we kick off today, I'm going to pass it over to the Seneca Ridge Dialysis team, and they're going to share what and how they do what they do that makes them so special. So before I do that, I just wanted to, again, thank everybody for joining us today. Remember to keep your lines on mute. If you've got questions, if you could put them in the chat and we will address them at the end of the call. And if you're having audio issues, I'd advise you to log out and log back in because I'm seeing that we do have audio for the other attendees. So it might be your computer, log out, log back in, and we'll go ahead and get started today. So I'm going to pass it over to the Seneca Ridge Dialysis team. Thank you guys so much for joining us today.
Thank you. All right. Good morning. I'm Colleen. I'm one of the social workers at Seneca Ridge Dialysis. I am going to give you a little bit of background information about our unit. Like Caroline said, we're in Rochester, New York, which is a pretty small city. We have currently about 240 in-center dialysis patients. We have 4 peritoneal patients and 8 home hemodialysis patients. We are currently the largest dialysis unit in Rochester. We have 48 chairs. So we dialyze a lot of patients at the same time. We primarily have a lower income population. We serve the majority of our patients do reside in the city of Rochester. We also have a very large percentage of both Spanish-speaking staff and patients, which works out quite nicely for our patients. Our clinic is very close-knit. We have many of our patients have had one or more family members who have or had treated at our clinic at the same time as they have. We've had several generations of the same family. We only serve adults. Our youngest patients are currently in their 20s, and our oldest patient just turned 97. We have 18% of our in-center patients actively listed for transplant, 25% of our peritoneal patients, and 17% of our home hemo patients. And we primarily work with the University of Rochester Strong Memorial Hospital, Erie County Medical Center, and Upstate University Hospital in Syracuse. We have found some barriers that were pretty common to all of our patients, and I'm sure common to everyone's patients, that the transplant workout process can be very overwhelming and prohibitive. We were finding that a lot of our patients have low health literacy. A lot of them have lower than average reading ability, so they have a hard time reading the lengthy letters of tests that the transplant center sent out. All of those are playing a role in their inability to navigate the process. We have a lot of patients who respond to us, I am too old. I don't want to take a good kidney away from someone that's younger than me. Patients have concerns about surgery. smoking and substance use, medical compliance. We also have some challenges with insurances. Our 3 clinics all take different insurances, and we've had to switch patients from one plan to another if they're rejected at one clinic to try and get them approved at another clinic. And we have a population with very tenuous housing sometimes. And we had a patient who was all ready to go for her intake appointment. Local center canceled it because even though she is housed, they don't consider where she is stable housing at this time. So that is that, and I'm going to pass it over to Paige.
Okay. Hello, everyone. My name's Paige. I am also one of the social workers at Seneca Ridge Dialysis. And so I will go through what we currently do in our transplant, quality improvement and encouragement with patients. So we have really worked on trying to establish a pro-transplant culture in our unit. We have monthly interdisciplinary transplant committee meetings where we discuss policy updates, the barriers patients are facing, improvement ideas, and just patient specific statuses and, kind of how we can best support specific patients. And then we also invite guest speakers to come. Actually, for our meeting this month, we have the director of New York Kidney coming to present to us. So that is, we try to stay up on our education there. So yeah, we had the opportunity to reestablish our transplant committee after the pandemic. Previously, it was more nurses and social workers, but now, we have nurses, social workers, techs, even the front access associates, nurse managers, dietitians, everybody involved. And, it just helps. We want everybody to feel comfortable talking about transplant with their patients because everybody has, a different relationship with patients. Some patients might connect better with their tech or, someone at the front. So, everybody's involved in supporting and trying to address issues that come up. We also try to visibly celebrate transplant successes in a way that all the staff can see and all the patients can see. We do a quarterly patient newsletter. And where we celebrate transplant successes, if someone's actively listed, if they, completed a step in the process, like they quit smoking, or they maybe they got their colonoscopy done, or they became listed, any sort of success with transplant. So I'll show you in the next slide some examples of what our most recent newsletter looks like, but we pass that out to all the patients and staff quarterly. And then we also, you can see on this slide, we have a board we have in our lobby room, our waiting room, that each time someone gets a transplant, we hang up a star with the date, and then on the side, we have a little chalkboard where we track the number of patients that have been transplanted in the year. And then we change the theme of that every year. So we've had butterflies, we've had flowers, and this year we did stars. So it's a nice way for patients to see how we're doing with transplant throughout the year. And then something we also recently started is we got a nice banner whenever someone is transplanted. We hang it up and it says, congratulations on your transplant. from your family at Seneca Ridge Dialysis. And then, we have that hanging up for usually about a week and with like a balloon. And then we take it down and then, hang it back up when somebody gets a transplant. So we want everybody to know and be involved in celebrating. Um, so here's our a little sample of what our summer newsletter looks like. We call our little section where we celebrate transplant the Transplant Triumph section. And, we with the patient's consent, we share their photo and then just a little if they want to share anything, some encouragement about their experience with the process or what they want to do after they're transplanted. One of our patients wants to travel to Switzerland once she gets her kidney transplant. And as you can see there, we celebrated a patient that quit smoking, so it's not just becoming actively listed. And then we also have like kidney transplant games. We had the crossword there, um, recipes, staff interview, all sorts of fun things. So that's been going very well. Another thing we do that is a fun thing, a favorite among staff and patients, we have an annual wellness day, sort of like lobby days, 2 days. So we catch the Monday, Wednesday, Friday, and Tuesday, Thursday, Saturday patients. And what we do is we invite community agencies to come into our lobby and meet with patients, share information, and help to address barriers that are experienced by a lot of our patients. So, for example, we have had physical therapy come. We've had resources on smoking cessation. The local transplant centers, of course, we've had them come. Insurance assistance, um, dental, National Kidney Foundation. We've even had, as you can see in the picture there, therapy dogs come, home dialysis, and our patient facility representatives come. So it's a fun event and a way to help patients that are working towards transplant or even those that aren't working towards transplant. We want everybody to be as healthy as they can be. And we also we have little raffle baskets we give away. We usually just have patients, we give them a ticket and they can put it in whatever basket they want. We try to give away a little food snack. I think we're planning to do apples for our next one. We've done little freezer pops, small sized freezer pops, and so that's patients love that. We have games, handouts, recipe books, also the dietitians put together. And we try to make it a fun themed event. Last summer, we did like a luau theme. This for the fall, we're trying to do like a fall theme and also focusing more on our Hispanic population. So trying to get some more like Spanish speaking services to come this year. So that's a helpful event. Um, We've also worked on streamlining communication with our local agencies, especially the transplant centers we work with. We have collaborated with each of them, met with each of them and determined their kind of evaluation and communication preferences, because they're all, slightly different. And also determined who the point people are to reach out to. So that's been helpful. And as well as how Colleen had touched on, we developed a clear list of insurances that are accepted at each center because they don't all work with the same insurances. So that's a big one. And then we maintain regular contact with our transplant centers. We have monthly reports that we fill out and send back to some. Some send us routine letter updates. And then also we the social workers are in contact with the transplant coordinators very regularly, emailing, hey, what's this person's status? Oh, what testing did they need? Or, someone got this test done, here's the note for that. So just trying to support the best we can. And then one thing that's kind of cool, we did determine that getting a dental appointment in a timely manner for our Medicaid patients was a big barrier. Patients would call and it would be months before they could get in to see a dentist that accepts Medicaid. And of course, dental clearance is a big part of the transplant evaluation process. So we reached out to our the dental clinic that is part of our health system, and we developed a relationship with them and a referral process so that we can get those patients seen in a timely manner. So that was very nice that they're willing to work with us and get our patients in. And we've been using that, and we've been seeing a lot of success with it, getting patients in to get their clearance and get their dental issues managed. So that is that, and I will pass it to John here.
Great. Okay. My name's Jonathan. I'm also one of the social workers here at Seneca Ridge. Involved in all these things that we're talking about. And also we should acknowledge Jennifer, who's our other social worker, who's not on this call. So we have all of us working on all of these things together. So continuing on with the other things that we do, that are trying a monthly support group. So we had sort of been thinking about it for a while, and I know at times, I'm sure maybe other facilities, it's a thing. And I know that they're from other patients always learning things that there are on social media, different sites that some of my patients, oh yeah, I do this group. I'm like, you do a group? What do you do? Oh, it's on this site and there's all these people and we share stuff every week. And I think the Kidney Foundation has something online. However, we were thinking of, well, we wanted to get back to do a live group in person. There again, obstacles in dialysis is, of course, I'm sure most people on the call know. I mean, if people are coming Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, how are they going to get there if they're doing dialysis? And to get, in on another day, well, then you get into the barrier, which we talked about earlier for other things of transportation, because many of our people rely on Medicaid transportation, and how would that work? So as this is going on, one of our very go-get-em newer patients, and she became one of our patient facility representatives, started a group on their own, which is great. And I'm not sure where they were in the community, maybe a community, somewhere in the community nearby. And they tried for a few months and tried to promote it, and their space wasn't good. And I said, maybe we can do it here. And we were thinking a Saturday or a Sunday. So we picked a Sunday. And so with the cooperation, we talked to our director, and he let us open the building because we're closed on Sunday to patients. And nobody's seen here. So we were allowed to open the building and have it on a Sunday, because that's really the only day that conceivably that patients could be, is open, that nobody would have dialysis that day. We also did it purposely because we were thinking morning, late morning, early afternoon, and we've modified the time a little because a lot of people go to church. And then there's the football game stuff. So there's a lot of logistics and figuring out when to this. So generally we've been meeting on Sundays at 1:00. And that's been going pretty well, I would say. So this is definitely, and how we do it, this is what I guess the model, like a peer-led group, a peer support group, or peer-led. So it's not exactly psychosocial or social workers. We're there to collaborate with them and facilitate. And I meet with the patient facility representative. We kind of get a few ideas. And if they need help, like, oh, we would really love to bring somebody in and talk about something. And, we can maybe find that for them. We have a local chapter. Fortunately, we haven't always in Rochester, I don't think, but we have currently a local chapter of the National Kidney Foundation. So that representative knows us from coming to things and, knows all the dialysis facilities. So they were able to come and share all just loads of information, that they had about various things. Another great one was just using what your resources that you have where you are. The dietitian came, and I'm sure they'll come more often. We have two full-time and one part-time dietitian here in the building. And so people always have questions. And also understanding and reinforcing with group, it was a good opportunity because people like, oh, I didn't know about this thing. And saying, well, if you need help, you might not see them when they come your day for dialysis, but you can always ask to see them and kind of get out that message. If somebody's not walking around, for that monthly, usually they round with the doctor once a month. Ask the nurse, say, I'd like to see my dietitian, and they'd be more than happy to talk to you at length, while you're here at dialysis or on the phone, if you want to learn more education. So that was very helpful in having them come, and they shared, ideas and suggestions for all kind of dietitian related stuff. So this is period. So we're on this month will be our 1 year anniversary. So they're excited about that. A few patients came. We had a kidney walk with the National Kidney Foundation. A few came to that. And for the people, we haven't got a huge amount. It's varied a little. I would say a good handful of people have come. And it's been like many support groups, people get what they want. And when they come in and then, not come for a few minutes or a new patient has come and, found it very helpful, then next month, other people might be there. But the core group who is there is really, I think found some meaning in it. And I think the people that have come have enjoyed being together. And it's nice to see that, to offer that in person. They also have met because they wanted to do a recipe day where they tasted stuff, and we can't do that here. So they met on their own in the nearest library to here and arranged all that themselves, and had somebody that somebody knew connection do a quick recipe, and people got to try that, and they really enjoyed that. What else? Okay, so the other program that we were asked by IPRO to kind of, one thing that was a little gap that was missing was the patient peer support for transplants. So we worked on that and have that going and have like a program for that. So newly established transplant patients, it says, can offer support and match them with patients who are, on that journey of transplant, either getting started here, thinking about it, not sure, or on the transplant list and have questions or concerns. And patients, can share their experience about the transplant process and provide support and encouragement. So we tried to keep track of some of the patients who have got transplants, and know that, hey, we're still thinking of you, and hey, would you, congratulations. And we send them a card from everybody's staff to make sure they're okay, and wishing them congratulations. And by the way, would you be interested in coming to talk to patients? So we have we have a new young man who was very enthusiastic and very grateful to get a transplant. And he also speaks Spanish. So that's a little plus, so we can focus on some of our Spanish speaking patients. So we have already getting a little handful of patients who are willing to talk to come back. Either, we sort of make the introduction, whether they want to come in and meet with the patient, or, just do that, share phone numbers and do that on the phone, whatever's easy. And I think we're going to have a transplanted patient come to the next wellness day that we're having. So to walk around and, come back and visit and share their experience. So that will be good. So like everybody, I'm sure everybody is doing, we're all same thing, social work assistant. So providing support and explaining all the things as part of our education and kind of continuing, because sometimes it's a lot, as you know, to remember all the things that people have to do, to get listed. And sometimes people forget, or they get notified, of course, but they forget to what else do I need? And they don't usually call the transplant center. It usually is on, they'll come to us and say, what else do I need? And then at every meeting, care plan meeting, we discuss that. But then when we're seeing them, and they know that they can call us, which they do, and ask, where they are along that way, in case they forget. Sometimes helping people, with the appointments, because as Colleen and was saying in the beginning, we work in our area. We have three. So one is local and the other are a good hour or more away. And then people can, of course, go outside of our region. But they, people don't, of course, know that they can go to the different centers. But then just kind of helping them understand the logistics of what's going on in the other dialysis centers and how they have that choice also to list there. Okay, so staff education is always transplant, always a part, but it wasn't that significant. We have do a lot of training. We have a nurse educator who does education, and there's always new techs and nurses training here to work here, and they have classes on all the things that they need. So we work with our nurse educator to have that be a little bit bigger focus and make sure that as we were talking about before, that everybody here, whoever you are, it doesn't matter. It's not just the nurse or social worker or your dietitian, that everybody understands this process pretty well. And that so that technicians, when they're working with people, they're spending a lot of time with them, that they're understanding this process. And that in the new staff orientation, that's the first, a significant education and understanding that they have a big part to share, and making sure that this is on everybody, as we say, to work with people, which I think is important. And we invited, as we said, all team members to attend the monthly education transplant webinars that we get, from different places. New York Kidney, or different places that have education, and we make sure that everybody kind of is aware about that if they want to attend those. Let's see, where are we? Okay, so the next part we wanted to add, and we're almost there. This is more, we're getting in the dietitian area, but we'll cover it for them because we were a big part about that, and phosphorus is not our area exactly, but we're all there again working with patients on these things too. One of our nurse leads was working somewhere in another, I think in the Midwest, and they had done a similar thing. He said, hey, we should be doing this. Phosphorus, as everybody, we all know on this call, is like such a huge obstacle in people in managing their phosphorus, because phosphorus is in all the things that we like to eat and some that we, shouldn't eat, and people have difficulty managing. It's a very hard thing to manage for many people. So a phosphorus bowl. So kind of copying, we're in football country here, is everywhere. Sure you are where you are. So nurses, dietitians, and social work staff have worked to create this phosphorus bowl, kind of a football themed, as you can see, to promote phosphorus awareness, education, discussion, and camaraderie mainly. So we're sort of following, we just started this and we created these they're pretty big. They're like poster size, what you see there. And we went around and kind of talked to patients, said, hey, this is coming and we're going to do this. And they were kind of, excited about it because people liked, the idea of, relating it to sort of football, and part is just another way to kind of get people talking and excited rather than hearing the same, whoever their dietitian or whoever go on and on about how they have to, what they have to do. It's like another fun way to get that message out there for people. So we sort of split up the shifts into teams, and I know there was a lot, and the dietitian could speak more, but on it, but it was a little bit confusing, but kind of getting it so it would be sort of fair, the amount of patients on each team. And then they sort of took like an average of what the phosphorus would be um, uh, and calculated. So they'll be calculating sort of a monthly average. So it's not as individual as sort of that team, like everybody scored together. The teams will be awarded points as we're just getting started on the collective phosphorus average to get that down. And the winning team will get a prize. And I think we're, of course, going to give a prize to everybody because, we want everybody to feel like just because you didn't win, maybe somebody really took steps to do better with their phosphorus. And that's really the idea that we'll highlight somebody who was the most improved, or it was funny because right away, two patients said, "Hey, did you hear about this?" And said, "Hey, you better start working on that. We got to work together on this, or how are we going to do that?" So there was some nice collaboration with patients just supporting each other, which was really cool that we heard that going on. And so we'll be giving out various little mini awards to everybody helped. So it's encouraging teamwork, a little fun competition. And patients supporting one another to reach their goals. And it's not as some people, of course, like everyone don't really care or don't know what you're doing, but a lot were kind of, excited about the idea of that and working on that together. I think that's about all we have. So yeah, so that's some of the things that we are doing here to kind of create interest and in transplant and getting people listed, which is our main goal, because we want everybody, if they're able to have a transplant and to be healthy and move along with their life.
Thank you guys so much for that information. I wanted to kick off the question portion of today. I do see, just for some housekeeping, I will be sending out a recording and the slides to everyone. They'll either come through email or through iProLearn. With that being said, you'll be able to zoom in on the pictures and see some of the writing if the images are too small for you right now. And that was one of the comments in the chat. We do have a question about what kind of prizes do you give? So the Phosphorus Bowl, you said the winning team / maybe everybody will get a prize at the end. This individual is looking for some suggestions for their unit.
Yes. Whatever we can find that is cheap, because we're not, we can't give out expensive things, and because our director said we don't have money for that, like I'm sure you hear. We're looking at different things, like sort of like award or medal, or on Amazon there were some really pretty good deals. You could buy a lot of like football shaped stress balls, like squishy balls. Which was really cool, and people like those, and that we could get a lot of them for like, $50. And that's supplying. I forgot how many we got for that. If you remember, Paige.
Yeah, I think was it 50 of them or 75?
Yeah, obviously searching for
Yeah.
things like that on the
And-
Amazon. There's a lot of like football merchandise things for like fun little things like that. So that's the direction we were going toward. I'm trying to think what else we have given out. Another, I should say that people really like the recipes, and easy, like to go on some of the sites that work with kidney patients, which we all know what they are. And there's a lot of recipes out there. We just made sure those are dietitian approved, but they looked at them. We also, we couldn't make food to give out. We really would have loved to do that and give, like when you go to the store and they give you a little sample of something, but we're not allowed to do that. So we, just kind of showed them all the stuff and had recipes available, but printing out, which is very reasonable. I mean, if you got a copy, just to print out, a bunch and make like a recipe booklet, people really like those. And that's a very low cost, just the cost of copies to do that. And the dietitians help with that. We also have copied them from cookbooks or from off the internet that were approved. And that was a nice thing to give away.
Yeah.
Yeah, I'm trying to think. We've done a lot of
Um,
any other things. Yeah,
Yeah.
things like that. Yeah, yeah.
Yeah, we've given, some for our lobby days as well, like just inexpensive little notebooks. Patients seem to love notebooks. We had some stress balls at one point. We gave those away. Pens, just about anything.
Like, yeah, little sugar-free candy we bought, hard candies, people like that.
Yeah.
Wonderful. We have another question. How do you address and approach HIPAA? You have the newsletter and you do the stars. I think the stars had the dates on it, but anything that's posted publicly for celebration or awareness, how does your facility address HIPAA or get consent prior to doing those initiatives?
Yeah.
So our
We
patients
do-
sign a media release
Yeah.
for the newsletter.
Yeah.
Yeah, and the stars just have the date of the transplant on them, not the names.
Wonderful. Media releases, is that something that you guys created or is it through your organization?
I believe it's through our health system.
Okay.
Because I think more could be shared. It is always that question of how much we can share. Like, I mean, if it's staying right here, like, could we post more? I think people would enjoy that more. But so far, right, we just have the date, and of who that was. And then for the newsletter, that's right. They all signed releases, and those are. I mean, they might take them, of course, but they're just we're handing out the newsletters to them. So that we got their permission to take their photos.
Mm.
Yeah.
Wonderful. Thank you.
Yeah.
And I just wanted to add quick, while this was, Seneca Ridge is doing the presentation, Rochester Regional Health has 6 dialysis units. And all of the teams at all of the units do not exactly the same, but we all do lobby days. We all follow the same basic transplant. We're all on the same transplant committee. So the other sites in our system all do the same things as well.
Wonderful.
Yeah.
There is a question. We have an attendee that joined late. Was curious if there was any ideas to encourage home patients. So a lot of the activities happen in the center. The awareness that you shared with the banners and some of the huddle boards that encourage patients. I know the lobby days are open to all, but any ideas for a home patient kind of
Yeah.
encouraging them and getting them involved in transplant?
Oh, in transplant. I was saying home dialysis because
Maybe
we worked
even
also on
home.
that.
Yeah.
Yeah, well, we actually had sort of a mini version where we focused more just on home dialysis, and we had the home nurse because we're all together here, and we had them come over with the patient facility representative and set up the machines, bring them over, and it right in our lobby so that people could see. And we did get some a good amount of interest. I would say a handful, that several people who were interested, and they in changing modality, and at least a lot more people like were educated about it also. And I think we're also asking people a little bit more, if I'm right, Colleen, when patients are starting, and I think everybody's doing that, but we're following up more on, patients, do you know about home dialysis? And if they didn't, because sometimes people come and they still don't know, or they have to start, right away, and they didn't get that option right away. And we have also a monthly class where they do, which I think others I'm sure do, that they talk about kidney issues and dialysis modalities. Getting the home patients could be invited to the lobby day, but it is a little different. You're right, because they're at home, so they're not here to like get all that information. So I just try to like reinforce that with them when they come in.
Yeah, we did give all the home dialysis patients newsletters as well. And there is a transplant board in the home
Yeah,
dialysis office as well. So,
yeah, so that's where we are at this point.
yeah, we do try to encourage
Hmm.
them to.
Okay, just to follow up, it said, did you do the phosphorus bowl with the home patients?
I can't, this is all very new in the past month that we got it started, and it's our first round of trying this. I think we were going to make them sort of one team. And forgive me if not, they could be. So we were going to sort of consider them one team, as you saw. So like some of the shifts was one team, and we had, as you saw, we named them all and gave them a color. So I think we were going to do, if not next time, that all the whole home group would be one department, would be one team. Yeah, so it certainly could be incorporated into that for sure, I think. Yeah, it'll be interesting to see how it all goes, but it's a little bit of calculation. And the dietitians are kind of managing that, but we're all, of course, helping. So it'll be fun to see how it goes.
Yeah, sounds great. A question says, who are you getting your transplant education from when you do it monthly?
Is it New York Kidney, the Echo?
Yeah, New York Kidney Echo webinars, we watch those. I know this month, one of the transplant centers we work with upstate, they're having an educational webinar that we sent out to our whole committee. Um, let's see, sometimes iPro. I think there's also something called Transplant Life, where they have webinars that we share. So yeah, a couple different sources where we get our education.
Wonderful. It looks like some of our attendees put in their own best practices in the chat, which is great. So if you're on the call and you want some more ideas, we do have some stuff in the chat about different gifts or prizes that were given away. Bingo. There is an RN on the call who created a word search puzzle. So lots of great sharing going on in the chat right now. Does anyone have any other comments or questions for our presenters today? Someone did confirm that transplant life is awesome. So yes, very good. Okay, I am gonna put in the chat real quick our post-call survey. For anyone who's on the call right now, we use this feedback to improve upon our offerings. And we'll also give this feedback to our presenters just so they know how good of a job they did today. So if you could fill that survey out, it only allows us all to get better. And so we'd be very appreciative of that. It looks like there's a lot of thank yous in the chat and not a lot more questions. So I think we might be good to close out today. I'll give it another couple of seconds if anyone wants to raise their hand or come off of mute even to ask a question directly. A lot of good kudos coming in if you guys are able to see the chat. It looks like we all enjoyed the call today. Thank you so much for your time today presenting and sharing these great practices. Everything that Seneca Ridge shared with us today has been documented already as a best practice and things that make a difference when it comes to waitlisting and transplant. I'm so fortunate to have come across your facility already conducting these different initiatives, whether it's team approach to transplant, everyone getting educated, the lobby days, the activities and the huddle boards for the patients, all of that really drives quality improvement. And I think on behalf of the iPro ESRE network and the rest of the community, that thank you for coming and sharing what you guys are doing on a day-to-day basis. So I think, yep, a lot of kudos coming in. I think we're good today. So we're going to close out. If you haven't done the post-call survey, please fill that out. And I think we're ready to close out. Wonderful.
Thank you so
Thank
much.
you.
Thanks.
Thank you.
Thank you.
Thank you.
Yeah.